My name's Lance Liberti, and I'll be your presenter for today's non-surgical knee pain relief solutions presented by Sound Integrated Medical Center, located in Federal Way, Washington. They can be reached at area code 253-205-8486 to ask any questions, verify your insurance benefits, or schedule your risk-free consultation. But we'll get to that again at the end of today's presentation. Before we begin, I'd like to define what we're here for. And the purpose of our workshop today is to provide help. We're going to be discussing some non-surgical treatment alternatives that may work for you, even if you've tried steroid injections, pain medications, anti-inflammatories, even surgical interventions without positive outcomes. Also, and I feel most importantly, is to share some hope with you. The reason I'm your presenter today is actually because I, like you, was in a situation with osteoarthritis of the knee. I had early onset osteoarthritis, told I was bone on bone, would need a knee replacement. At that point in time, I was very depressed with the prognosis and thought I didn't have any options when I was introduced to one of the original FDA-approved viscosupplement medications called Hyalgin through a client of mine whose father was a doctor of osteopathy injecting this medicine. And it helped me regain my strength and function and eliminate my pain when I was told that nothing else would work. You see, I had suffered a high school football injury, blocking on a kick return. I got hit by a helmet on the side of my right knee and kind of fell backwards over the person that got pushed into me, and I tore a few major ligaments that required surgical repair. While initially I got my function back a few years later, I lost most of the function in that knee. So I went and got an MRI to see what was going wrong, and I was bone-on-bone contact medially on the inside of my knee and was told that knee replacement surgery would be my only option by both the radiologist and the orthopedic surgeon who was working on my case. Luckily, I got introduced to this injection medication, and it worked well for me and provided many years of pain-free relief. I had another round of injections done in 2013, kind of as a fill-up, if you will, and that's kept me good and functional for another over 7 years so far. So I've been sharing my experience with others, and actually that process began with a doctor who injected my knee almost 2 decades ago. I convinced him to leave his job working for an orthopedic clinic and open a practice focused on the non-surgical treatment of osteoarthritis of the knee. And in that facility is where we developed the Advanced Arthritis Relief Protocol. This is the treatment approach we'll be discussing today, which has now been trained and certified in over 200 locations in 38 states, including Sound Integrated Medicine there in Federal Way, Washington, with Dr. Phoebe and the rest of his clinical staff. So a little bit about your local provider. Sound Integrated Medical Center specializes not only in the non-surgical advanced arthritis relief protocol, but also in many different regenerative techniques, such as platelet-rich plasma, where we take a concentrate of growth factor from your own blood to help to stimulate soft tissue rejuvenation in meniscal tears, rotator cuff tears, other orthopedic injuries, as well as other regenerative tissue therapies such as mesenchymal stem cells, amniotic fluid, and also certain other medications that are non-steroidal anti-inflammatories used for hot spots that you might be having pain and suffering from, called trigger points and so forth. The facility has radiology on site to take x-rays, look inside your knee, see what's going on, as well as video x-ray to perform guided injections that guarantee and assure the medication gets into the knee capsule or the bursa of the shoulder where it's required for your treatment. But before we get into all those fine details and the risk-free consultation offer, I'd like to talk a little more broadly about knee pain. Knee pain is a very common condition in the United States. Behind back pain, it's the second leading cause of musculoskeletal pain in our country. And it results in over 700,000 people having knee replacement surgeries in 2013, according to the CDC. Last year, that number grew to over 1 million. Many people are told that surgery is their only option, but I'm living proof that that's not true. So why is knee pain so prevalent? It affects over 40 million people at any given moment in the United States. The CDC estimates that by 2030, over 70 million Americans are going to be diagnosed with osteoarthritis of the knee. It causes hundreds of millions of office visits, billions of dollars of expense to the healthcare system, and is the leading cause of disability in the elderly as well as loss of work. Osteoarthritis is the primary cause of most knee pain in the United States. It's a degenerative condition of the bones, joints, cartilage, and it can result in pain, swelling, and loss of function in the joint. Osteoarthritis cases are on the rise quite dramatically. Over the last 25 years, there's been about 20 million individual increase in the United States. Over the next 10 years, they're expecting another 20 plus million people to be diagnosed on top of our current figures. So you are definitely not alone in your struggles. This is one of the most common degenerative diseases in the United States. In fact, out of all types of arthritis, osteoarthritis is by far the most common. It affects almost 10 times as many people as rheumatoid arthritis, which you might find to be quite surprising because when we turn on the television, most of the commercials we see for arthritis medications are for rheumatoid arthritis, like Enbrel, or for psoriatic arthritis, not for osteoarthritis, even though it's much more common. And that's because osteoarthritis has a mechanical component to it. It's not something that can be easily fixed with a pill or a quick fix, if you will. So osteoarthritis, aside from being the most common form of arthritis, is often referred to as wear and tear arthritis. And most adults over 50 years old have active osteoarthritis with some type of pain or loss of function. I've found over the years in looking at thousands of x-rays throughout the facilities we work with that most people 35 and older actually have some early signs of osteoarthritis. And osteoarthritis actually starts out as what I like to call a drying problem, because before you have loss of your cartilage and destruction of the bones and hard tissues, there's a fluid-filled capsule called the synovium that is your first line of defense and cushioning and lubrication of the joint. And the dysfunction begins there before these hard tissues ever become damaged. So why the knee? Well, we've been using it regularly since we were about a year old and started walking. It bears about 80% of our body weight on a daily basis. Osteoarthritis can be exacerbated and happen early onset because of injuries like the sports injury that I suffered from, or if you're in an auto accident and hit the steering wheel or dashboard, if you have a big fall and your knee hits the concrete, or even from accumulation of little micro traumas like bumping your knee on a coffee table can damage the synovial sites, the little glands that produce the hyaluronic acid and synovial fluid inside that joint capsule. As we age, the more mileage we put on our knees, the more likely we are to have dysfunction. The more we weigh, the more likely we are to develop dysfunction because we're putting a greater load over time on the joint. And then also deformity. If you've ever heard the term knock-kneed or bow-legged, that is kind of the common speak for a varus or valgus deformity. And you see our knees commonly fall out of alignment. About 85% of people have a medial loss of joint space and misalignment. About 15% have a lateral or external loss of joint space and alignment on the outside aspect of the knee. So I like to use automotive analogies. They tend to be very relevant to the problem that we're suffering from with the knee. And if you've ever had a car where your alignment went bad, you've noticed that you go through tires really quickly because you have an uneven wear. If you're asking just part of that tire to bear the entire load versus the entire surface area, it fails much more quickly and will eventually lead to a blowout if you don't fix that alignment issue. Well, our knees are not extremely different from that. They can bear weight very effectively. It's what they were designed to do. They can go front to back for a long, long time without a problem. It's once you start introducing an uneven load or rotation or sheer lateral movements that the knee begins to fail. And that's why in sports, you see most of the knee injuries are not from a head-on impact or collision, but from a side impact or collision, because the joint's not designed to bear as much stress and weight on that angular plane as it is on a front to back motion. So let's look at an anatomical drawing of the knee real quick, just to talk about some of the normal structures. This triangular shaped thing you see here is your patella or your kneecap. And it's designed to ride in between this channel here, in between the femoral condyles, much like how a sliding glass door goes smoothly on its track. But if it ever falls out of track, it can grind and be very difficult to move. Your kneecap is not much different than that. This white substance you see here surrounding the end of the bones is called hyaline or articular cartilage. And that's designed to protect the blood vessels and nerve endings that wrap the bones and keep them from becoming exposed and damaged. In between the joint, you've got a meniscal soft cartilage, and then you also have this synovial fluid that will cushion and lubricate the joint, allowing it to glide next to each other. You see, when all of our joints are working properly from our fingers to our toes, they don't actually touch each other. It's not like a door where there's a hinge and there's a physical friction every time you move it. all of our joints actually are designed to glide next to each other. They're not like a hinge.